Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Today we're talking about IBS, Irritable Bowel Syndrome. It is a problem that affects a lot of folks, and it causes a lot of gastrointestinal issues and discomfort. So how do you identify it? What are your symptoms? And what can you do about it? We're talking with Gastroenterologist Marc Subik about that today. Tell me some of the symptoms that people can watch for that might indicate they have IBS.
Yeah, IBS, Irritable Bowel Syndrome, is a very common problem that we as gastroenterologists see, and primary care providers as well. And as far as a GI practice, it might be 25 to 40% of your office visits, some form of irritable bowel, and the associated symptoms with it. IBS is defined as a chronic abdominal pain with change in bowel habits without organic cause. Organic cause meaning infection, inflammation, ulcer, cancer, etc. So some of the symptoms that might be present in IBS are numerous and myriad. Nausea can be part of it, abdominal gas, bloating, distension, belly pain, epigastric discomfort, diarrhea, constipation, cramping, are all things that can be seen, either all of them or just one or two of them in IBS type patients.
Are there degrees to IBS? Are there symptoms that are occasional and then some that really require medical attention?
There are degrees of symptoms, and they do vary from person to person. So I see people that are severely affected with IBS type symptoms, and others that just have an occasional GI flare or IBS flare, if you will, and in between are perfectly fine. So it really does vary from patient to patient, the degree of symptoms and what those symptoms are. A lot of IBS goes undiagnosed. Because the types of symptoms and the degree of symptomatology is not anything that alarms the patient, so they just sort of write it off and they live with it. They don't get a specific diagnosis because either they don't see a GI person for it or they don't see their PCP for it, so they're undiagnosed.
Let's talk about those treatments. What kind of things can be done to find relief?
It depends on what the symptoms are. Since there is no specific cause for irritable bowel, it's not like you have pneumonia and you identify the organism, you take an antibiotic, and you're good to go. With IBS, the treatment basically is treating the specific types of symptoms. So if it was nausea is the main problem, which you can see in epigastric pain, you might use a nausea medication, you might use an ulcer pill to treat the pain issues and epigastric burning type of symptoms, even though you may not have an ulcer, sometimes those are effective. So if you have constipation as your primary issue, you'll be treated for constipation. If it's diarrhea, we'll treat you for diarrhea. So the treatment is basically symptom directed, depending on how the patient presents and the types of problems that they have.
And how big a part does lifestyle and dietary, how big a part does that play in IBS?
It's very important, and a lot of people will tell you that, if I eat foods A, B, or C, then I've got bloating and gas and diarrhea and symptoms along those lines. So diet is really important, and most of the patients know that already. They've tried to tailor their diet, and so it is something that they need to pay attention. And if certain foods aggravate their symptoms, and if they tell me about it, and we'll try to treat with medication so that maybe they can still eat a particular food, but not have symptoms to that great a degree. Or if that doesn't work, you're looking at limiting that food, eliminating or eliminating it entirely, depending on what the patient preferences are.
some great information for people to try to deal with symptoms of IBS. I appreciate your time, Dr. Subik. Thank you.
Good to be here.
Thanks for being here for Monday Health Minutes.